joined by Dr. Jennifer Knudtson with the Reproductive Endocrinology and Infertility at University of Texas Health. You're also the assistant professor there?
Yes.
Okay. Well, thank you so much for joining us here today.
Well, thanks for having me.
And you were actually one of the recipients of a grant from the Endometriosis Foundation of America. Talk a little bit about that grant.
So what we're looking at is trying to determine the role of estrogen receptor beta in the early endometriotic lesion. And the reason we think this is important is a lot of studies have shown that estrogen receptor beta is in the late lesions, and we know it's in the developed endometriosis. But what we want to know is it in the early lesion, and if it is there a way we can help maybe prevent recurrent endometriosis in the future, or is there a way we can actually prevent it from forming?
And where are you currently in that study?
We're in the beginning stages. We're looking at the actual cells and testing the receptor status, and then kind of correlating the receptor status to how sticky or how much those cells attach to other tissues.
And again, why is it so important that you kind of figure out what's going on in the beginning? Do you think that that's going to have an impact on maybe future treatment, or what is that going to do down the road? That's
our hope. The hope is that so many women, don't always respond to medical management, or they've had, multiple surgeries, and so we have to look for other options to try to help their disease status. And so if we can find more about the pathogenesis and why it develops, the hope is that we can help those women that aren't treated by the usual treatment options.
And just one last question, how do you try to empower young women that may have endometriosis?
I think education is important, and the other is confirmation. I think these patients come in, they suffer this debilitating pain, and they need to hear it from someone that it is a disease, and these are the things we can do to help. And as a specialist, trying to look into all the different options to really kind of tailor individualized treatment.
Thank you very much for being with us.
That was good.